Hello, everybody. Welcome to the Long COVID Support Group meeting. My name is Brian McComb. I'm a family practice doc here in Manistee, Michigan. I've been in Manistee since the end of 2003, and I've been employed by Munson Healthcare since our hospital here joined Munson Healthcare about 5 or 6 years ago. I am currently seeing patients a couple of days a week, and then the rest of the week I spend my time as the Chief Medical Officer here for Munson Healthcare Manistee Hospital. So I think we can go ahead and get started. And I just wanted to start with a slide that kind of explains or shows some of the different names that long COVID has been called thus far through this time period. So you can see them there. There's everything from the PASC, which is post-acute sequelae of SARS-CoV-2, to the long haulers. For the purposes of this meeting, I think we'll stick with long COVID. I think it sounds the best out of all of those. It's certainly easier than the post-acute sequelae of SARS-CoV-2 name. So we'll go with long COVID. So what causes long COVID? Basically, long COVID can happen to anyone that has had COVID already. Long COVID can happen in people with mild or severe symptoms. So if you have a pretty mild case of COVID, you can still have long COVID symptoms long after. And there's no real clear link or correlation between risk factors and long-term problems. The studies on this are really just getting going. They're ongoing and continuing and probably will continue for quite some time. There's some theories about what causes the organ damage and what causes the persistent inflammatory or autoimmune response, or does the persistent inflammatory and autoimmune response cause the organ damage? There's still a lot of back and forth about how this is really going to play out, and we'll learn more as we go forward. But there definitely seems to be a link to the autoimmune response and something called a cytokine storm, which I'll talk about a little bit more later. These are some of the most common lasting symptoms according to the CDC. And you can see from this list, you're probably reading it and thinking, I've got that, I've got that, I've got that. These are just the tip. There are a lot more symptoms that are just not as common, but these are certainly the most common ones. Again, the prolonged immune response seems to be what triggers a lot of this, and that cytokine storm. The cytokine is it's a cell in your immune system that is normally mildly active, but in certain situations it gets a little bit hyperreactive and it causes all the other cells in the immune system to react as well. Excuse me. So these things just kind of start this whole storm process, and that's why it's been called the cytokine storm. And when you have that happen, there can be a lot of different lasting effects on the tissues and some of the other things that you can see from this list. So we'll go through and kind of cover some of these things that can happen individually, and I'll try and give you a little bit more information on that. So we all know that there can be some breathing issues after COVID-19. It can cause scarring and other permanent problems in the lungs. It may take several months, even longer than that, to get some lung function back so that you're back to pre-COVID levels. Some of the things that you can use that are very helpful is respiratory therapy. I think if you have an opportunity or a need, you should definitely take advantage of it. I think it would be very helpful for you to kind of help get your lungs back to pre-COVID levels. And then they can teach you a lot of the breathing exercises that would be very helpful. There's also things like inhalers and steroids and other medications that are being explored. I think all of those would be helpful, either at least only short term, but possibly even long term, to kind of get you back to pre-COVID levels. And then if we move on to heart issues with the long COVID, this is felt to be related primarily to inflammation of the heart muscle. And this goes back to that autoimmune response and persistent inflammatory response that we have seen with COVID. The myocarditis is a term for basically just that inflammation of the heart muscle, and it can cause shortness of breath, palpitations, rapid heartbeat when you get it. This is something that can be reversible. I've had, or I know of a patient that had myocarditis following her bout with COVID, and she had some symptoms for about 6 to 8 weeks, and then it gradually got better, and her follow-up exams did show that the inflammation had receded and gone. So there are some cases where it definitely can improve, so that's encouraging. If we move on to the loss of taste and smell, about 75% of the people that have long COVID or COVID in general will suffer with this loss of taste and smell. It can linger for several months. Studies do suggest that 60 to 80% will improve within a year, though, so that is also encouraging. If we move on to the neurologic problems in long COVID, and you've heard the term brain fog and fatigue, headaches, dizziness, all this is linked to long COVID. Its cause is not really clear, but there's a lot of good people doing some investigations here and really trying to figure out what, if anything, we can do to help speed the recovery here. You can also see that COVID can affect the autonomic nervous system. The autonomic nervous system is the nervous system that handles all the things that we do every day, all the time, but don't ever think about, like breathing, heart rate, those kind of things, adjustments in our blood pressure as we stand or sit, those kind of things are all handled by that. And that's why if it does get affected, you can have that POTS syndrome, which is the postural orthostatic tachycardia syndrome. And this is felt to also relate or contribute at least to brain fog, fatigue, headaches, insomnia, all those kind of things. If you do end up with the POTS syndrome, there are some medications that can be used to help boost your blood pressure and help keep you from having that orthostatic symptom, which is when you stand up quickly, your blood pressure doesn't respond as fast and you get lightheaded and dizzy and just don't feel yourself. There's a lot of studies that also show that aerobic exercise, healthy diet, avoiding alcohol, sleeping well, doing some cognitive stimulating stuff, even music has been shown to kind of help get the brain fog process heading in the right direction and improving it. So that's something to kind of think about as well. And there'll be more on that as we go through this presentation. I'm sure you'll run into it when you start to seek treatment options for yourself. I wanted to touch a little bit on some mental health issues as well. Anxiety, depression, the post-intensive care syndrome are all things that we've seen with COVID and long COVID, and even people that don't necessarily have long COVID. There's been an increase in anxiety, depression around just the pandemic itself and everything that we've all had to deal with in the last almost 2 years now. So there are a lot of good medications available to help with depression and anxiety. There's a number of different classes. When I first started my career, there was not a lot of great options for this. But now we've got a lot of really good options to help. So definitely if you're feeling depressed and anxious, you should talk to your provider. There are some good options for you to kind of help here. The post-intensive care syndrome is really just a lot of the same physical symptoms as long COVID, but PTSD kind of falls into this category as well. It's just having to be stuck in an ICU for an extended period of time. It just tends to really wear on people, and it is very common. We see it frequently when people are in that kind of situation for a long time. Getting patients up and moving well and moving quickly is something that will definitely help in trying to improve all that, but it can be difficult when you're stuck in that COVID situation. So it's something that we're working on and have been looking at for a while now since the pandemic has started. So how long can COVID last? The answer really is unknown. It can be weeks to months. Things do improve. You have to try and give yourself the best chance to improve, though, by doing some of those things we talked about a little bit earlier, exercising, trying to get that good aerobic exercise, build your endurance. Those things will all very much help. Eat healthy, sleep when you need to, and also talk to your providers. Let them know what your symptoms are. They can't really help you if they don't know what the problems are. So talk to them and share that information with them so they can get you the best possible treatment options. And some of it may just be, your treatment is to try and exercise, but take that to heart. It's something that you can really work with and really improve your chances long term and maybe perhaps shorten the course of long COVID for you. We'll talk a little bit about treatment here. There's not a lot that we can throw on this slide, but I'd like to emphasize the PT and the RT, which is physical therapy, respiratory therapy. I think these things, I've seen them do wonderful things for people with long COVID, getting their stamina back up and being able to get away from oxygen a lot faster. So I would definitely encourage you to explore those. There's not much that can be done for the loss of taste and smell, like we mentioned, but 60 to 80% of those improve within a year. And again, I'd encourage you to really talk to your providers. If you're not getting the information you need, be a strong advocate for yourself. I would just encourage you to do that. And we'll move on and talk a little bit about when you should call your provider. So I think basically it's anytime you have a symptom that is disrupting your normal quality of life. If there's anything that feels like it's not right, you should probably talk to the provider about it. There may be something else going on that we can then track down for you and solve that problem. And it may not be COVID related at all. But I think if you bring that symptom or that problem up, we can certainly track it down and try and get a good answer for you. I would also encourage you, if you're not getting good results from your current provider, feel free to seek out another provider. There's nothing wrong with that. Some are going to be more responsive than others to this. Having done this presentation and seen what it's done to my patients and some friends and colleagues, I feel very strongly about this and would be, one that would definitely want to hear about all those things. And I think most providers are in that category. But if you're struggling, I'd encourage you to be that advocate for yourself. Get out there and find someone that's going to be able to give you the best possible chance to improve there. Don't feel like you're bothering us, because you're not. We get calls all the time and we're used to it, and we're more than happy to try and help. So let's talk a little bit about long COVID in the future. So, SARS-CoV-2 has only been around since December of 2019. There's still an awful lot to learn, and there's a lot of really good minds working on this, and studies are ongoing, and new insights will definitely provide new avenues for therapies. There's just a lot happening behind the scenes on a lot of the different things. And so just know that a lot of time and money and effort is going into trying to find these answers, and stay positive. And again, be that advocate for yourself. I think that's the best thing you can do. And by all means, talk to your providers. Don't be shy about it. If it's something that you're not sure, but it's disrupting your quality of life, definitely talk to them. I think that's very important. And I wish you all the best. I hope all of you do great going forward. And I just hope that we can get answers for you quickly, and that you stay well and get well fast. So thank you for listening. And if you have any questions, we'll be able to answer those as the presentation goes on.